Square Up Health. New study led by T. Charles Witzel finds an inadequate health response to MPOX outbreak. A study conducted among gay, bisexual, and other men who have sex with men in the United Kingdom revealed challenges in accessing medical testing and treatment for MPOX, formerly known as monkeypox. Participants reported facing stigma associated with disease and encountering negative reactions from both heterosexual and LGBTQ+ communities upon receiving their diagnoses. Published in the eClinicalMedicine, the study named experiences of MPOX illness and case management among cis and transgender gay, bisexual, and other men who have sex with men in England. A qualitative study utilized in-depth interviews with 22 people in the study who contracted MPOX and 4 stakeholders from clinical and communication organizations. Conducted between March and July 2023, the interviews provided valuable insights to the experiences and case managements of MPOX illness among this demographic. Following the U.S. Government Accountability Office's report on 2022 outbreak, the UK study has emerged. Prompted by the U.S. report, gay U.S. Representative Ritchie Torres introduced the Coordinated Agency Response Enactment Act this month, aiming to revamp federal public health emergency management. Healthcare advocates have been pointing out that the LGBTQ+ community in America has been facing stigma over MPOX and has interfered with the acceptance for medical prevention. The UK study has published recently by the lead researcher T. Charles Witzel. So MPOX, right? You know, one of the things I have to say about MPOX is us as gay men in the community, when we went through COVID, all of us survived COVID, right? Or most, I should say a lot of us did. But in that case, when MPOX hit us as gay men, we're kind of a little vain, right? So when we saw the images of what MPOX was doing to people, we were lining up for the vaccines. So I think, at least in Broward County, we did a great job, I feel, is preparing ourselves for MPOX. We still have a lot to do. If you look at the study for the state of Florida in general, only 28% of the people they identified that should have received an MPOX only has received one vaccine. And only 20% of those people have received both vaccines.
Interesting.
Yeah.
You know, I remember when access to, like, Broward County was pretty ahead of its time in that way that it got access to those vaccines, right? That is, most cities, including lots of major metropolitan areas, simply didn't get access to the MPOX vaccine until, in some instances, it was just far too. It had spread pretty wildly, right? To me, this story tells us so much, right? And I about what we stand to learn from past pandemics too, right? That is, in some ways, if you had just kind of swapped the MPOX for HIV, the story would have looked a lot like it reads similarly, right? That is, whether it's stigma, whether it's access to care, we've made so many of the same mistakes, and haven't learned enough from our past and present, right? That is, of course, because HIV is not over, right? But in that way, it sounds just kind of eerily like other pandemics and those that affect, of course, the LGBTQ community in disproportionate numbers.
With no help from the state, of course. But I definitely want to give a shout out to Nikki Fried, because I remember when this outbreak occurred and literally no one was talking about it at all. And I texted her and I was like, hey, Broward County is like the center of this right now. We need vaccines. And she was on the phone with the White House that same day, right after I texted her.
That's amazing.
And we had those vaccines down here. And that just really goes to show, like, having a voice at that state level is important, because it's not, you know, the federal government can't do everything, but it's important that the local folks here at the local level take the lead. And they did in Broward County. And just looking at these numbers, I know you're going to talk a little bit about that. It's frightening. It really is frightening, because a lot of people just don't know. And they have no idea. And I mean, especially reaching the younger folks, we got to find different ways to reach them and let them know how to get the vaccine.
What a great perspective.
You hit something very important, and it's having representation at the local level as well as the state level. And so just a little nod to you. Like, you are an incredible young man, and we are so lucky to have you as part of our community, already making strides to represent us in government. If we talk about the HIV epidemic, that knocked out an entire generation of politicians and representatives, as well as, you know, artists and historians and Medicare people, medical people. But yeah, thank you for what you're doing and leading that.
You've been fighting this fight and including so many young folks into the conversation and facilitating that conversation for so many people.
And I know Rep. Chip LaMarca is going to be kind of upset when I say this, but it is true, and we should always remember that Ronald Reagan really screwed us up. And I think a lot of folks don't know their history, they don't talk about it. I mean, whether that's HIV, and now that attitude that people have is still here, about, vaccines and, like we were just talking about with the stigma. The first thing people are saying, this is a gay disease and this is an STD, even though it's not. And we shouldn't care. That's your lifestyle. Even though it affects straight people.
And I think what's important to note too, we're coming up on Pride season. And for those individuals who've not received one or even two of those vaccinations, please get your vaccination. You can't find it in town, call Holy Cross. We will get you taken care of. That's not a problem.
For COVID too, that is, not everyone did survive COVID. Or that is, it's really important, and they're still not. It's important to note, that the accessibility of vaccines when they're made available to you, there's so much misinformation out there, but that education's key, right?
Absolutely.
Yeah.